Good morning and welcome. My name is Robert Karua. We are live at the BICC in the capital Lilongwe this morning. We are here because of the African Institute for Development Policy. Well, they're here to actually discuss quite a number of issues. Different people from different organizations have actually here to attend this meeting to discuss more on financing the emerging technologies in order to improve healthcare delivery systems in Africa. And with me is the Executive Director for AFIDEP, that's Dr. Zulu, who's going to shed more light on why we are here this morning. Dr. Zulu, why are we here this morning? And I can see that there are quite a number of representatives from different international organizations.
Yes, good morning. And we are here on this convening that we have on really examining the role, the benefits of emerging technologies to improve healthcare in Africa. It's an Africa-wide conference that has brought participants from 16 African countries and a number of participants from Malawi as well. The main aim is really to look at these emerging technologies. First, what are emerging technologies? Emerging technologies are really new innovations that are coming up in the health sector with the aim of improving healthcare. But many of them are new to the extent that they are not part of the typical healthcare system. They are not part of the policy or regulatory framework. You look at technology like artificial intelligence, use of drones, things like gene-drive mosquitoes, blockchains, and so on. They are technologies that have been developed with big potential to improve delivery of healthcare, but they are not really known that well, and they are not used widely. So this meeting is meant to really bring experts from across the continent to examine these technologies that the African Union, through the high-level panel for emerging technologies, which is fully here, they approved these technologies. The technologies include, as I said, artificial intelligence. The first group of things that will be discussed will be technologies on digital technologies. So these include artificial intelligence, blockchain, Internet of Medical Things, drones, and so on. So where you are using digital technology to improve medical care. Another group of technologies that will be looked at later this afternoon are biological technologies, and these include genomic medicine, a biospecimen and biobanks, and as well as genetically based vector control like gene-drive mosquitoes, as I said. So it's really looking at these technologies. The third group will be technologies aimed at improving child and maternal health. And finally, we'll look at technologies for One Health. One Health looks at the intersection between human health, animal health, and the environment. So there we are looking at technologies that are critical for that. So the aim really is to say Africa has very high disease burden. You look at any statistic, Africa is behind compared to other regions. And these technologies can help the continent leapfrog in its progress in addressing these. Yet they are not that widely known. They are not in the policy frameworks. So the experts are here to review what progress have we made. What are the experiences that various countries have using these technologies, and how can we improve? So it's a very important conference that is bringing science, but with the main aim of how do you apply these innovations into healthcare processes to improve the well-being of people across the continent.
Thank you so much, Dr. Zulu. We'll be chatting to you more just soon after the meeting is done. Thank you so much. That's Dr. Zulu, the Executive Director for AFIDEP, telling us more about why we're here this morning and also why it is important to make sure that these technologies are working and improving the healthcare systems in different countries. Well, let's get inside and hear more from the participants that have flown in from different countries to discuss issues to do with technologies and also how we can improve the healthcare system.
It's an honor. It's a real big honor to be among you, moderating this first session. I want to start by recognizing the presence of officials from the Ministry of Health, the PS from the Ministry, Dr. Samson Ndolo, We recognize your presence. We also want to recognize the presence of the Chief of Staff at AUDA NEPAD, Dr. Msingati Sipuka. We also want to recognize the presence of the Science Advisor to the African Union Commission, AUC, Mr. Haole Menyani. We want to recognize the presence of the Chair of APET. The APET is the AU High-Level Panel on Emerging Technologies. Professor Yaye Gassama, we recognize your presence. She's also been Minister of Education, Science and Technology in Senegal a couple of years ago. We want to recognize the presence of Vice Chancellors from Malawi University of Science and Technology, Professor Malata. We also want to recognize the presence of Vice Chancellor Luana University, Professor Kaunda. And we recognize all leaders here. I might not have all names of all the top leaders here, but we recognize all of you. And we really thank you for giving us, being able to join us this morning. So I just want to really get us started. We are here to talk about emerging technologies to improve healthcare. It's the regional dialogue on leveraging emerging technologies to improve healthcare on the continent. And as I was thinking about just this starting session, one of the things that was going through my mind is, why are we talking about these technologies? Why are we here? Many of us have traveled so far, to be in Lilongwe this morning. And we are here because disease burden remains really big on the continent. We know that we are making progress, so we are not downplaying that. Countries have made a lot of progress over the last so many years. I was earlier this morning looking at reports on progress on disease burden in the different countries on the continent, reports from the WHO, and indeed we are making progress. They do recognize various countries that are making progress, particularly towards the various targets of the SDGs. And so even as we make progress, we know that there's still a lot to be done. And I think we all know that. So I won't even go into the statistics. We know that we are still, disproportionately carrying the burden of deaths, the burden of ill health on the continent. Issues around communicable diseases, remain really critical. We've talked about malaria for many years. We've talked about TB. We've talked about HIV, And we've talked about what they call NTDs, neglected tropical diseases. And I know sometimes I use that word and people say, who has neglected these diseases? And why are we calling them neglected? Neglected by who? But we know that those diseases remain, the numbers are still very high. And a lot of people continue to die on this continent because of this. And most of these deaths are actually preventable. We also know that non-communicable diseases are catching up. So even as we deal with this burden of infectious diseases, cardiovascular diseases, becoming among some of the top killers: cancer, diabetes, respiratory traction infections. And so as we manage to start bringing down the burden of disease on infectious diseases, NCDs are also rising, And within that, we have the challenge of climate change. And we know how that is just complicating things. We are talking about mosquitoes that are able to transmit malaria in places where they were just not there. Some of us who may have come from Nairobi, we know that many of us have loved to live in Nairobi because the mosquitoes in Nairobi don't transmit malaria, right? But now we are moving to a point where there are these urban mosquitoes moving to cities ready to transmit malaria. And so the whole climate change issue is complicating, the disease burden. But we also know that our healthcare systems remain weak. The investments, the capacities, the infrastructure. And so we are here because of that, because we believe that emerging technologies could play a big role. In some cases, they could play a big role in leapfrogging us over some of these challenges, And we know that they could speak, to some of the weaknesses in our healthcare systems. But they can only do that if they're very well developed, right? They can only do that if we are putting in the investments. They can only do that if we have the capacities to harness them. They can only do that if we have the policy and regulatory frameworks, And so we are here because many of us believe that emerging technologies provide a really viable solution for the continent, but there's a lot more that needs to be done, and that's why we are here. Just to looking at some of the things that, and we're going to be talking about this for today and the next couple of days, but we know that some of these emerging technologies can really enable early detection of disease, and we know that that makes a big difference for some of these diseases. You know, if you can be detected with cancer in the very early stages, it saves your life. You know, much of what is going on in the continent is that we are detecting it in stage 4, and then we end up just supervising death. You know, and some of these technologies could help us in addressing that. We also know that some of these technologies could enable very targeted and effective treatment. They could also enable getting services to very rural and hard-to-reach communities. And we know that some countries are already experimenting, you know, with some of these technologies. And so really, we hope that the conversations in the coming day, today and tomorrow, will be looking at how do we address these barriers for Africa to actually harness emerging technologies to improve lives, reduce number of deaths, and just enable Africans to live a quality life. Issues around lacking capacity, you know, infrastructure. Some of the technologies we are talking about here need electricity, but we also know that in some parts of the country, electricity remains a problem. You know, so how can these technologies be helpful? We know that some of them mean that we need to retrain, you know, healthcare workers. We need to even retrain ourselves. A few weeks ago, I was in a meeting where we were talking about some of these technologies, particularly technologies around Internet of Medical Things, and just realizing that we are already using some of these tools. You know, I know some of us wear those nice things on your wrist when you're walking, but are we using that data and tracking it? So how do we maximize? Issues around weak policy and regulatory framework remain big because some of these technologies are also they're not traditional. So they really need us to step back, look at our policy frameworks, look at our regulatory frameworks, and just be clear on what needs to change. Because for those that have potential to really change health, we are looking at them being able to be scaled. And, you know, scaling can't happen if we don't have the right policy framework, regulatory framework. We're also looking at investments. I think investments always remain the big challenge, you know, because we won't harness these technologies without investing, putting in the money. And where is the money going to come from? We also know that a lot of our countries are grappling with public debt, right? Nowadays, most of our budgets actually going to public debt. You know, so where is money going to come from for us to invest and be able to harness these technologies? And so we are here because AUDA, NEPAD, and AFIDEP are partnering to provide a platform that can regularly convene key leaders, officials in the room for us to share lessons, but also for us, importantly, to address issues that are standing in our way to make progress on these emerging technologies. We know that the AUDA, NEPAD, through the high-level panel on emerging technologies, has identified 10 priority technologies for different issues in development. And for us here, we are focusing on health, but we are also looking at those top technologies they have prioritized to understand how can this be better harnessed for improving health on the continent. And so the dialogue is focusing on emerging technologies very much in the area of health. And of course, focusing very much on what do we need to do differently in terms of policy, in terms of regulatory frameworks, in terms of investments, if Africa is going to benefit from these technologies. We have just 4 main objectives for this forum. The first one is really deepening understanding among key stakeholders for the different technologies. The second one is to share experiences and lessons. Really learning from each other is so critical for the progress that we need to make. The third one is to identify actions, you know, through your insights, actions that different levels of governance on the continent need to undertake, but also different stakeholders need to undertake, because we know that it's not government alone that is going to solve this problem. And then, of course, we also hope that the dialogue will generate commitment and actions, you know, that need to, you know, start accelerating progress in the use of these technologies. We have a very light agenda for the next 2 days, and so we are starting off this morning with opening remarks from key leaders, which I'm going to be facilitating, and then we are going then to get into panels for the most of the day and the following day. And so at this point, in the interest of time, I would like to call upon Dr. Leah Zulu, Executive Director of AFIDEP, African Institute for Development Policy, to give his opening remarks. Welcome, Dr. Zulu.
Good morning, everybody. That didn't sound like really a big good morning. Good morning, Africa.
Good morning.
All right. Really, I'm very, very pleased to be here on behalf of our colleagues at AFIDEP to welcome you to this regional dialogue on leveraging emerging technologies to improve healthcare delivery systems in Africa. I think Dr. Oronje has really articulated why we are here. And for me, I just really want to welcome you, but also tell you a little bit about our institute, AFIDEP, for those who don't know much about what we do. But let me start by really acknowledging the presence of the Secretary for Health for the Republic of Malawi, who is representing the minister. The minister was coming here until last evening when she had to be in this emergency SADC meeting for ministers of health to look at the mpox situation in Africa. So she sent the PS, who was also supposed to be in the same meeting, to give backup technical support to the minister. But we are really grateful when a PS, when a Secretary for Health, I always confuse SH, PS, but I think it's more or less like along the same lines. But just to say thank you very much, sir, for coming to demonstrate the support of the government of Malawi for this convening. Also, Professor Yaye Kene Gasama, the chair of the African Union High-Level Panel for Emerging Technologies, and the members, the esteemed members of the panel. I think there are 8 of them physically in Malawi, and 2 have been joining meetings virtually. Mr. Lamenyani, the science advisor to the African Union Commission Chair, Science, Technology and Innovation Advisor. Mr. Dr. Msingati Sibuka, the Chief of Staff at the African Union Development Agency, AFIDEP, and staff from AFIDEP. The Vice Chancellors are Professor Malata, Malawi University of Science and Technology. I think we also have our colleagues, the Vice Chancellor from Luana, the University of Agriculture, the Rongo University of Agriculture is supposed to be here as well. We have colleagues from the Kamuzu University of Health Sciences, Professor Futso Bengo and the team there. That is really playing a big role in supporting the government, the Ministry of Health, in laying the policy framework, the assessment framework for emerging technology in the country. Really very, very happy to have you here. Scientists from across the continent, ladies and gentlemen. So, really welcome, as I said, to this meeting. It's really a very, very big honor for AFIDEP and to work with AFIDEP. AFIDEP and AFIDEP signed an MOU to really work together to really fully optimize the synergies that are there between what AFIDEP does as the former African Union Development Agency, and for us as an organization that focuses on really promoting evidence use in decision making. AFIDEP is the African Institute for Development Policy. We were established in 2010. We are a Pan-African research organization, research and policy institute. Our main aim is to help accelerate development efforts in Africa by bridging the gaps between research, policy, and practice. So much research being done on the continent. It's like a research lab of sorts, right? Every villager there's this questionnaire today, so much work being done. A lot of data being accumulated. I think when you ask the question, how much of this evidence is on the table when decision makers are making the critical decisions about the development of the continent, about the healthcare delivery, how much of it is on the table to inform priority setting, to inform resource allocation, to inform determination of cost-effective interventions, but even more critically, to inform performance. How do we learn to make sure that everybody talks about, oh, Africa is rich in policy but poor in implementation? We have to ask the question, what is the role of evidence in closing that gap? What program evaluation processes do we need to have in place? Monitoring processes, so that we improve performance as we are delivering, so that we stop programs that are not having positive impact and reinforce those that are having good impact. And more, I think the more critical thing is even how do we, there's so much small projects happening across the continent at experimental level in districts and so on. Some of our organizations, we've divided up districts, those who do delivery of programs. One in these, in every country, I think there's a well-known of 5, 6, 8 districts that are known as the most marginalized districts, right? And a lot of, whether it's UN agencies and everybody is going there with their programs. I think the question we need to ask is, at what point are we going to graduate one of these districts from being the most marginalized to being, after such intense program activity over 20, 30 years? So we have to ask ourselves, are we really after changing? But the bigger question we need to ask ourselves even on that is, as we are working in these small districts, are we working in such a way that we draw lessons that then we can bring to Bwanaisearch here to say we worked in Shisi district or in Homa Bay in Kenya, and as a result of our work, we came up with this intervention that is really very, very impactful. Can we implement it at scale? So a lot of us are doing small things, and at the end of the day, really not having much impact. So evidence is very, very critical, and that's why AFIDEP exists. We are like the bridge between research to reinforce the bridging of that gap between research, policy, and practice. Really understanding that research can do more. Many of you are, as listening, professors, assistant professors, top scientists. We know there's the word publish or perish, right? That's what brings us up the university radar. But I think the point is that we can publish, but we can also participate more in the development processes of Africa. And that it doesn't have to be too much of a choice. But I think we've been talking like with Professor Malata, some universities, to say universities also need to start thinking about maybe changing incentive structures. If there's a professor who has, we look at many of us, the big universities here, Malawi University of Science and Technologies in Cholo. We have a lot of our colleagues in Malawi, Kuhes in Blantyre. The work of working in policy processes is really a lot of work. To sit in those technical working groups, to understand the needs of government. The days are gone when the researchers should do their research and think that the way to promote uptake of research is just doing a dissemination seminar. People in government are attending dissemination seminars. You leave today, there will be somebody tomorrow who will do another dissemination seminar. So the question is, how are you really going to engage with the policy-making processes so that you understand the problems, but also the research that we are producing is aligned with the needs of the government? I think that's what we need to put more focus on, and that's what AFIDEP believes in. We are an organization, we work in... So our work at AFIDEP is in two streams. First, we have a program that focuses on building capacity, strengthening capacity for evidence use in the public sector. So we have a curriculum that where we train our policymakers at director, below those guys who write the technical documents. But we also engage policymakers, the leadership, on the resources that governments need to put in place to make sure that evidence is used systematically in decision making. Ministries of Health already collect so much data. That Health Information Management System, data, DHIS2 data. To what extent is that data even being analyzed, a big investment just to get that data. But how much of it is being used to really inform decision making? And how many of us as researchers are even using a lot of that data to analyze, to help governments make the right decisions? So we do that, and then we work in 6 areas where we do more in-depth research. And these 6 areas are health and well-being, population dynamics and the demographic dividend, governance and accountability, environment and climate change, transformative education and skills development, and gender equity. Our headquarters is here in Malawi now. We moved it from Nairobi 2 years ago, thanks to the Malawi government that gave us diplomatic status for us to really run this Pan-African organization from Malawi and really promote the interchange of ideas on how to address Africa's development problems. There are 75 staff now, 15 have PhDs in a range of those disciplines I talked about, 40 have master's degrees, and so on. And so we are really proud, but I think more critically for us is the partnerships that will really help to make a difference. The work we are doing with AFIDEP now, we've worked with many of the organizations that are here. It's through partnership that Africans, especially, a lot of us tend to partner as Africans through partnerships that are initiated by organizations in the global north. We need to reinforce partnership among ourselves more. Because that's the only way we are going to own and drive the continent's development agenda. We have to define where we need to go. We need to engage on these transformative technologies, as Dr. Oronje was saying, so that things are not just being imposed. There are a lot of organizations out there that have so much power. The international, whether it's bilaterals or multilaterals, that when they go and see the Minister of Finance, the minister can cancel your meeting, even when you have the best science, because the next guy coming in is coming with a big bag of money, that they will come, not ask the minister to say, what are your priorities, we want to help, but to say, these are our priorities, are you going to take the money? So at the end of the day, we end up implementing a lot of things that are not really properly informed by the actual needs of people around the continent. So our job as we work with governments, we also have to put a lot of effort in engaging with these other guys, the partners, the development partners who come there, and sometimes because they come with resources, they have bigger influence than the locals who might have the big ideas on what needs to be done. So I'll end by just saying I'm a demographer by training, and I always throw in a population number there. Africa now has 1.5 billion people. In 2050, Africa will have 2.5. We're going to add another billion people between now, which is what, 26 years? We'll add 1 billion people to the global population. The only continent that is going to continue growing throughout this century is Africa. So the continent has the numbers. The question is, are we ready to turn these numbers into quality human capital that will drive the socio-economic development agenda, that will drive the achievement of Africa's 2063? I think if we go by status quo, it's not promising. But I think if we act with urgency, this is possible. And so, emerging technologies, technology, innovation, science is very, very critical. Because if we have to ask the question, where will the African jobs for all these young people come from? I think it has to come from, we might do a bit of industrialization, and those of us working in energy need to help do that. But it will most probably come from the service sector, innovation, and so on, and how we use technology to leapfrog our progress will be very, very critical. So I look forward to the conversations over the next couple of days. You are the brains, and I think with Africa, us owning this development agenda, we can really go far as a continent. Thank you very much.
Thank you so much, Dr. Zulu, for those remarks, and just reminding us about investing in the Gen Zs. Because the numbers that are going to, be developing the world in the next 25 years, they won't be able to develop the world if they don't have the right education, right? If the continent is where we are. So we need to do a lot more and drive this and leave a legacy. Many of us will be exiting in the next 26 years. So we need to leave a legacy and leave a better Africa. Thank you so much for those remarks. I just want to check with colleagues who are on translation that you're receiving translation. It's very easy for us who are not on translation to just go on. So I just need a confirmation. Is translation happening? Yeah, I can see. Fantastic. Thank you so much. And I would like to challenge each one of us. Like I said, we have about 16 countries represented, so we don't leave this dialogue without learning some new word from a different African language that says hello. I know many of us will live here with Takula and Dirani, which says welcome. And a lot of us know Jambo because we know Jambo. Let's learn something from our neighbors, some new word from our neighbors, because Africa is us. I would like to invite Dr. Musingati Sipuka. Dr. Musingati is the Chief of Staff at the African Union Development Agency, AUDA NEPAD, to give his opening remarks. Welcome.
Good morning, everyone. If I could get some assistance on this. Often you hear people complaining that the podium is too tall. It's rare that you find that one complains about the podium being too short. So some of us are advantaged. Yeah. Okay, thank you very much. So some of us are a little bit advantaged, so the normal situation often disturbs us. No, thank you very much. First and foremost, I want to acknowledge that over the past 2 days, most of us have been, or some of us rather, have been privileged to be sitting in the leading up to discussions of APED, anticipating your arrival. So we've been privy to much of the discussions that have happened in relation to the subject matter that we are going to be speaking about today. So with that privilege, I think it's only fair to warn you in advance that certainly what you are going to be exposed to is an intellectually stimulating 2 days on the basis of the work that will be presented and that will be discussed in the room for the next 2 days. I was certainly very pleasantly engaged by the discussions that happened. I was saying to a colleague that often we deal with approval of memos and doing all of these operational things, and it's very rare in our line of work these days that you are in spaces that are able to capture you in terms of development of the African continent and what Africa really needs in terms of moving forward its agenda of development. So certainly, I think with the wealth of knowledge that we've had over the past 2 days, and I hear through the introduction that wealth of knowledge has been doubled, tripled, quadrupled, etc. So I think we can only expect to receive much more engagements and wealth of substantive inputs in relation to that. I think it's important that as a starting point we pay homage and tribute to the leadership of APED through the Madam Chair and the rest of the team that she works with. I think the decision, as we've been saying, that was taken by the leadership of the African Union in 2016 to give birth to the high-level panel on emerging technologies was indeed the right discussion, and it was indeed the right decision, because it has influenced, not in theoretical terms, but rather in practical terms, the discourse of how Africa engages with this idea of emerging technologies, but not necessarily for the sake of emerging technologies themselves, but rather on how emerging technologies influence the trajectory and the pathways of development in the continent. So for today, the focus of our conversation will be the health sector, indeed. But I think it's important to let the audience know that the work that has happened under this platform that has been created spreads across far wider than the health platform, and I think indeed necessarily so. It's important that it looks at sectors, but also it's important that its contribution goes far wider to see how we are able to integrate the work to deliver on human development across the African continent. And the reality, I liked what the minister, and it stuck with me because it reinforces an idea. I liked what the minister said yesterday when we had an engagement with her, Dr. Zulu, where she said that we need to move away from this siloed approach of looking at the human being or the citizen, where we look at them from a lens of what we are concerned about in terms of our thematic interest. So if we are sitting in health, we are concerned about the citizen in as far as the malaria question. If we are looking at the citizen, we are looking at them from a lens of mpox only. But the reality of the matter is that you have to look at the citizen in totality in terms of their exposure, in terms of the investments that we make that are going to protect them from all of these health pandemics and all of these health negative consequences that they confront. But it's not only health that we are dealing with. We're dealing with the human well-being from an economic perspective. We're dealing with the human being from a social development perspective. And that's, I think, the fundamental idea around which we have framed the work that we've done under Sustainable Development Goals, but more importantly from an African perspective, the work that we have framed in relation to Agenda 2063, where we look at the holistic development of the African citizen and we look at the holistic development of the African continent. One of the things that I thought I was going to do today was perhaps to run you through where we are as a continent in terms of our planning regime and our trajectory that we anticipate should be taking us into 2034, which represents the second 10 years of implementation of Agenda 2063. However, I'm aware that the opening remarks are perhaps less about the speeches because the substance and the meat of what we are going to receive is going to come through the panel discussion. So from that perspective, I wanted to focus on perhaps a singular, what we have termed as the moonshots of Agenda 2063, or rather of the second 10-year implementation plan of Agenda 2063, because it's important that we familiarize ourselves with the planning instruments and the planning tools that have been developed by the continent in relation to how we want to achieve the Africa that we want as we move to 2063. And that particular moonshot focuses on what we have defined as that each and every single African Union member state should by 2034 attain middle income status. And when we looked at the data, that would mean that in the course of the next 10 years, give or take, you're looking at about a transition of no less than 50% of African member states that will at least attain or graduate from low-income countries into middle-income countries. So what does that practically mean? It has to talk about the nature of the investments that we make in the African continent. And we've identified a number of drivers that we believe are crucial for us to unlock in terms of attaining that middle income status within this 50% of African countries that we've identified that would need to make the transition, but also not leaving those who are already in middle income where they are, ensuring that we are at least able to graduate some countries into high income status as well. Amongst those, of course, naturally would be questions that relate to the economy, industrial development, efficiencies in terms of the manufacturing sector, as Dr. Zulu has said, trying to find improvements into our services sector and ensuring that we are able to absorb as many of our young people into the economy as possible. But an interesting fact is that as we considered this what you would call an economic target for the continent, we realized that there are social determinants that are going to be able to drive how we are able to arrive at that particular point. And one of those social determinants is health. Because if you do not have the human capital that is skilled, that is trained, that is well equipped, but importantly, that whose well-being from a health status is taken care of, you don't have the critical input in that equation to be able to drive any transition of the African economy. So what that underlies or underscores is the absolute importance of the discussion and the conversation that we are having today from one perspective, the perspective of the investments that must be made in order to ensure the health and well-being of the African citizens so that they can be able to play in a very meaningful way their contribution towards the attainment of all of these targets and these indicators that we've set for ourselves. So the discussion from our perspective is that the discussion that you are having today is an absolutely crucial one, and it's an absolutely crucial ingredient in the equation for development of our continent. So that's on one piece. It's the health component. But I think then when you combine the health conversation, Dr. Zulu, with the emerging technologies conversation on the other hand, and you bring them together under one roof for a discussion, you're really speaking about the ability to address what you were saying, Rose, in terms of really scaling up how we are able to deliver on our health mandate in the continent and the spin-off that it would have broadly in terms of the objectives that we have as a continent. So from our end, these are just opening remarks. We simply wanted to say that the discussion that is being held this morning, I think for us is crucial. It's important because we think that it's at the center of the work that we do as the African Union Development Agency and the mandate that we hold from our member states in terms of, amongst others, driving the intellectual thought process in the continent that would guide our member states on how to effectively implement some of the strategies that we have that relate to our sectoral priorities, of which the health sector is one of them. So from that perspective, we'd really want to say thank you very much to AFIDEP for their thought leadership on the issue. Thank you very much to AFIDEP for the collaboration and for bringing us here for the 2 days of the regional dialogue. And I think most importantly, we should not underplay the importance of everyone who is sitting here, because without you, I think we would not have a regional dialogue, we'd be speaking amongst ourselves. And I think it's a first step towards a dissemination process of the product that we have. But we do have to inject innovation and different ways of doing things, even in relation to that topic of how do we disseminate the work that we've produced, because certainly it is profound, and I think it is a product that the continent needs, and it's something that we would need to drive forward in terms of actually lifting up concrete projects that would be able to drive the implementation of it. So with those words, thank you very much, and we hope that you have a pleasant 2 days, and we will be with you between now and tomorrow, and thank you very much.
Thank you so much, Dr. Sipuka, for those very, very insightful remarks. You've reminded us about the need for us to work in an integrated manner, which is really critical. And you've also mentioned how that integration and looking at an individual as a person with many different issues, and health is one of them, but also reminding us about the 7 moonshots or ambitions of the second 10-year implementation plan of Agenda 2063. I don't know if there are people in this room who know those moonshots off the top of their fingers, apart from Dr. Sipuka and his team. I know them, so I actually quickly looked at them, so I'm going to remind us just in a minute what those moonshots are. One of them is a prosperous Africa. So that at the end of these 10 years, and these 10 years are 2024, I believe, or 2023 to
34.
To 34. So to 34. So the next 10 years. At the second, so that is getting all our countries to middle income status. Now that's a lot of work for us to be able to achieve that. But we all want that, because there's a way living in a context that has less poverty improves your health, right? We all know that. The second one is integrated and connected continent. So just ensuring we're not working in silos again, but we are connected, not just in the countries, but even the different sectors and the countries. The third one is governance, public institutions that are responsive to our needs. And I'm smiling because I don't know why that's not the first one. I think Africans really want public institutions that are speaking to our needs. We've seen what has been going on in Kenya in the recent, it's about public institutions not responding to our needs. And we think that is an issue that needs to be addressed across the continent. The issue of peace, whenever there is peace, then there is no health and there is nothing else. That's number 4. Number 5 is culture. Our values so important because any society is held together by the values that we subscribe to. Number 6 is people-driven. We won't develop without good education, without health systems, without providing food, agriculture. So looking at all this human capital development. And number 7, which is the final one, is partnerships. I just thought I should flag those because often we know the SDGs. Many of us know the SDGs so well. But when you come back to our own document and our own goals we have set, then you start grappling in the dark to say, what are those moonshots? So I just thought I should flag that. But thank you so much for reminding us about those. And I would like to ask the technical team, the ones who are helping us with the systems. I actually had this moved down when I first, but it looks like our brothers who are very tall are getting punished. So if the technical people can be around to ensure that whenever a tall person comes, you don't suffer because some of us are so down to earth. I've been reminded to say, you don't say you're short, you say you're down to earth. So I am down to earth, but I don't want to have everybody else punished who's going to talk. With that, I would like to invite Mr. Hao Lemenyane. You'll realize I'm avoiding pronouncing the whole name. He will pronounce it himself because it's very difficult. Mr. Lemenyane is the science advisor to the African Union Commission Chair. Welcome, Mr. Lemenyane.
Okay, good morning. I'm not that down to earth, but also I'm not that gifted. So I think the mic will be just fine to be twisted a little bit. Good morning, everybody. I stand on the protocol that has already been established. And thank you, Dr. Rose. My name is Khao Khakala. Okay? Khao Khakala Lemenyane. I think Professor Abigail appreciates the kh and the khs that come out of Botswana. Instead of a g, it's a kh. Yes. So that's Botswana, and the long names and the meanings, and parents telling their stories through the naming of their children. So that's really how the names come about. The name means not far. I guess not far from God. So that's what my name means. So it's such a privilege and honor to be here, ladies and gentlemen, amongst the cream of the cream of Africa, of the African continent. And as mentioned, I am advisor to the chairperson of the African Union Commission on Education, Science, Technology, and Innovation. And I have, over the past 3 years, worked quite extensively with APET. And the last time I met this wonderful team of people was in Harare. Remember, I haven't seen all the people that were in Harare, but I've seen quite a few other people. And I think during the course of the day, I will come to you and greet you, just so you know, we recognize you, I see you, and it's such a great honor to reconnect once again. And in Harare, we were engaging on the issue of African economic integration, and we discussed the issues around the establishment of the AFCFTA, the African Continental Free Trade Agreement, and that, you know, this issue of Africa being the begging basket of the world. You know, we didn't start poor. Mansa Musa established Africa as the potentially trading with the rest of the world. And today we are moving on to the issue of leveraging emerging technologies to improve health. And I just want to speak now about the work that continues, the great work that we continue to do in these different platforms. And to say to you, I received greetings from the chairperson who is currently in China, attending the FOCAC summit with a lot of other African leaders. Who are currently engaging to try and negotiate mutually beneficial agreements with the Chinese government. And Dr. Spuga and I spoke earlier about how, as a continent, we engage with the rest of the world, where 55 African leaders would all leave to one country in Asia or in Europe or in America, and that those are conversations that we need to have, whether it's a really fair portrayal of what we are as Africans, where the entire continent of 1.5 billion people would go to one country, but anyway, those are political issues that we can engage with at different platforms. So I just want to bring to you the fact that the mandate of the current commission leadership ends next year, March. And so the new leadership will be elected at the 38th summit, which will be held in Addis Ababa in February. And I'm mentioning this because we do so much work, and the work that we do needs to continue. The health of the people must remain a priority of every leadership that comes into to lead the continental body. And so what I want to say is that in order for this work to continue, I mean, there is the technical people who are engaged on regular positions at the commission. But also, it's very important that the political leadership that comes in every 4 years gets to appreciate the work that has been done already, just so that can be put on the priority, on the list as they come in, or be brought into the consciousness of the new leadership. We know that when leaders come in, they've got their own ideas of what the priorities should be. But I'm saying to you, this work need not fall by the sideways because new leadership has come in. And we have got to be conscious of how we introduce this work to the new leadership. As soon as the leadership, my advice would be, as soon as the new leadership is in place, there must be meetings in order to bring this work to the consciousness of the new leadership so that they can rearrange their priorities or reorder their priorities to know that there has been work that has been done. And it's very important, and I liked what Dr. Spooker said yesterday, that as much as the technical advice would be there, political leadership is very, very important so that this work can continue. I'm sure we will say a lot more during the panel discussions, and I just want to say it's such a great honor to be here amongst highly distinguished, accomplished scholars and innovators, young people, and people who really are the heartbeat of this continent. And with the work that you do, we hope that it would impact all the people across the continent. And I want to thank you for giving me the opportunity.
Thank you very much, Mr. Lemenyane. Now I know how to pronounce your first name. I come from a community in Kenya where pronouncing that name is not very hard because we have a lot of ha. So for me, Hao Hakala sounds like a name from Western Kenya. So thank you so much. The point you bring up about politics is so critical. We all know that we can have all solutions, isn't it? But as long as the politics is not right, those solutions won't change the lives of, the common wananchis walking on the streets of Lilongwe, And so we are so happy you're here because we are looking at you for opening that door. We also know that political leaders can be very busy, especially when it comes to matters science, right? And so you provide that link, just ensuring that, and it's really good that APET leaders are here, as that organ that has been set up by the political leadership to engage on science. And so as the new leadership comes in the next couple of months, we'll ensure that there's that opportunity for that engagement, because politics is great, but if politics is informed and driven by science, it's even better, for the citizens of Africa. So thank you so much. I would like to now invite Professor Yaye Gassama, the chair of the AU High-Level Panel on Emerging Technologies, to just give us great insights. Welcome, Prof.
So thank you, Rose, for this introduction. Good morning to everybody. It's not so loud. I need to hear you. So good morning? Good morning. Yes. So let me... So first of all, I want to welcome you warmly to this regional dialogue on leveraging emerging technologies to improve healthcare delivery in Africa. So before I start my speech, I would like to recognize some eminent personalities who are here in the audience. And first of all, I would like to recognize the distinguished representative of the Honorable Minister Humbize Kandodo Chiponda. We have here Dr. Samungolo, Secretary of the Minister of Health in Malawi. We have Dr. Lemenyane, Scientific Advisor of the Chairperson of AUC, African Union Commission, Monsieur Misungati Sipuka, Chief of Staff of AUGA, NEPAD. Dr. Elia Zulu, who we invited us and who bring all the facilities to make this event happen, and I want to thank him heartfully. Professor Malata, she is Vice Chancellor of the University of Science and Technology of Malawi. I want also to recognize Professor Ambali, here there. He is Senior and Scientific Advisor of AFIDEP. Honorable members of AFIDEP, dear members of the CGED, and dear members of the Joint Secretariat, AUDA, AUC, AFIDEP. So it's an honor for me to stand here to discuss a subject that is not only pivotal to our future, but also full of hope for our continent. As we gather here to explore the potential of emerging technologies in healthcare for Africa, I would like to emphasize that we are on a brink of a new era, an era where Africa has the opportunity to redefine its destiny through innovation, through creativity, and the strategic deployment of cutting-edge technologies. Africa, a continent which is rich in culture, resources, human potential, stands at a critical juncture. For too long, we have been seen as followers in the global technical area. However, the tides are turning, and emerging technologies such as genomic medicine, gene drive, artificial intelligence, blockchain, the Internet of Things, and others offer unique chance to leapfrog traditional development barriers and carve out a new pathway toward prosperity. In healthcare, telemedicine and IoT devices are extending the reach of medical services to communities that were previously underserved. And these technologies allow us to monitor patient health remotely, diagnose diseases early, and deliver care efficiently. And this is particularly crucial in a continent where healthcare resources are often stretched thin. By leveraging technology, we can improve health outcomes and enhance the quality of life for millions of Africans. AUDA AFIDEP, in collaboration with AFIDEP, the African Institute for Development Policy, are engaged and dedicated to put at the forefront the implementation of emerging technologies with an expected high leveraging effect to boost health sector in Africa. And challenge in health are continuously tackling the efforts of development in Africa country. Many call for a more evidence-based, what Dr. Elia Zulu mentioned and pinpoint earlier. It's a need for more evidence-based and systematic decision-making process, especially with respect to complex and drastic threats to the future. So, ladies and gentlemen, the potential of emerging technologies to transform Africa is immense. But it's not automatic. And to harness this potential, we must invest in our digital infrastructure, cultivate a skilled workforce, and create policies that encourage innovation while protecting our citizens. We must ensure also that the benefits of these emerging technologies are shared equitably, leaving no one behind. Africa's journey to technological leadership will not be without challenges, but I'm confident that vision, determination, and collaboration I have seen here with the AFIDEP, AUDA, NEPAD, and all other partners, the Ministry of Health. With this collaboration, we can overcome them. Together, we can build an Africa that is not just a consumer of technology, but a creator of technology. A continent that drives global innovation, sets the standards, and shapes the future. So on this word, I want to thank AFIDEP, thank the Ministry of Health of Malawi for the support given to this collaboration, AUDA, AFIDEP, and thank all the participants for their great commitment. Thank you so much.
Thank you so much, Professor Gassama, Chair of APET. Thank you for those very inspiring remarks and reminding us that we stand at a point where we can make a big difference, particularly if we are able to accelerate progress on harnessing emerging technology, that it could drastically, change the story of health on the continent. And of course, the fact that we can do it. We shouldn't just be consumers, as Africa has been for many decades, but that we can be creators, innovators, people who are producing and selling technologies to the world. Thank you so much for those inspiring remarks. At this point, I would like to invite our keynote address from the representative of the Minister for Health, Honorable Kumpize Kandodo Chiponda. We were with the Minister last evening, as Dr. Zulu said. She's not able to be here this morning, but we are really honored to have the Secretary of Health, Ministry of Health in Malawi, Dr. Samson Mundolo, who will give us keynote remarks. Dr. Samson, welcome.
Congratulations to the Master of Ceremony. My name is also difficult to pronounce, just like Mr. Remanyandis, but she has done it well. So last evening, as you have heard, Dr. Zulu and Tim were gracious enough and invited us for a short chat. My big ears were listening to a story. So a young lady was saying she spent 2 nights or a night scribbling a speech for her boss. They went to the meeting. The boss never mentioned a word. And I said, I'm guilty of the same. Today, I will not do that. The work that the team has done, I'll read word by word religiously. But before that, let me say that when I hear healthy innovations, I'm very excited, not because I'm a doctor, but because I'm a potential patient. So we are all potential patients, and if we do not improve services, I think we know what will happen to us. Yeah? A lot of innovations in bicycles, motorcycles, etc. But if we ignore health, that would be a big issue. We need healthy farmers, we need healthy miners, we need healthy tourists. If you're Malawian, the ATM strategy, so health is in the center of it. Let me go back to my speech now. Again, regards from the Honorable Minister of Health. As you have heard, she's not able to make it this morning. Elia Zulu got what he wanted, and I had to run and come be with you. But as a ministry, we appreciate what AFIDEP are doing in Malawi. They've been a very great partner. Let me recognize the chairperson of the African Union High-Level Panel on Emerging Technologies, Professor Yaya Kene Gassama, the Science Advisor to the African Union Commission, Chair, Mr. Lemenyane. For obvious reasons, I've skipped the first one. The Chief of Staff, African Union Development Agency, Dr. Spuka, the Vice Chancellor, the Malawi University of Science and Technology, the Executive Director and Country Representative of AFIDEP, Dr. Elia Zulu, and your team. I'm also told I can see my professor from KUHES, Professor Mfusobengo, and your team, my colleagues from the ministry, and all officials from AUDA, NEPAD, distinguished ladies and gentlemen, good morning. Again, we should be able to innovate, and the mic should be able to judge the height of the individuals coming. We should not really struggle. We should be moving towards that. I'm honored to stand before all of you. Difficult to speak in front of professors, and after renowned professors have spoken. As I said, as a Minister of Health, we are so excited when we hear health innovations. We are always grappling for solutions to make care better. We probably remain the only continent in the world that still sends patients abroad for care, and some of the issues we send them for could be sorted out if we had simple things, simple innovations. Some of them will be just to identify what the issue is. By 2063 or by 2034, we really need to make a huge progress. Africa stands at a pivotal moment in history. So we are moving away from infectious diseases, and now we are grappling with non-communicable diseases. The need for innovative, scalable, and sustainable health solutions is now more urgent than ever. So my biggest problem has always been, at primary care level. How do we identify the issues or the problems there as early as possible, treat them, so that they don't worsen and get referred through secondary, tertiary, etc., etc. By the time they come to the tertiary level, it is in a state that is not reversible. So that's my problem as a doctor, and this is the innovation that I'm hoping as Africa, as we move forward, we should be looking at. We should not commit the mistake that Dr. Elia Zulu was talking about, donors who come with a bag of money and priorities. Again, as innovators, you and us, the care providers, must talk. We should tell you the priority areas where we need innovations. So that discussion is quite important, because whatever you bring should be responding to the questions or the issues that we have on the ground. Today, we are presented with an unprecedented opportunity. Emerging health technologies ranging from digital health platforms and telemedicine to artificial intelligence and genomic medicine. All these offer us ways to address our continent's unique healthcare challenges. These technologies can help us overcome many barriers of distance. So we still have some remote areas where the officer there has basic knowledge in medicine. We should be able to find a way of helping them, giving them a second opinion, etc., without having to move the patient 500 or 300 kilometers. We're also short of human resource, so these innovations should be able to help us where we have a gap in human resource. One of the most promising areas is digital health, mobile health applications, electronic health records, and medicine platforms revolutionizing how we deliver care. In the ministry, we run what we call Chipatala Japafone, which is a health center by the telephone, where people are able, using a toll-free number, they can talk to healthcare workers, give them advice, etc., etc. You can imagine these are people who would have probably have walked hundreds of kilometers just for information. Some of the issues are discussed over the phone and are resolved. Advice is given to them on how to proceed. So these are things that we are looking for. Digital health platforms also empower individuals to take charge of their own health by providing them with access to information, support, and monitoring tools. However, to fully realize the potential of digital health, we must invest in the necessary infrastructure, particularly in rural areas. This includes expanding internet connectivity, ensuring availability of digital devices, and training healthcare professionals to use these tools effectively. Actually, something that can work offline is even much better. Additionally, we must address issues of data security and patient privacy to build trust in the new systems. Ladies and gentlemen, artificial intelligence and the big data also transforming the healthcare landscape. Artificial intelligence-driven diagnostic tools can enhance the accuracy and the speed of disease detection, while predictive analytics can help us identify and mitigate public health risks before they escalate. The Ministry and the Kamuzu University of Health Sciences planning to work on a project in Blantyre. Vice Chancellor, I did not say you. Let me acknowledge your presence, Vice Chancellor Kohes. So, among one of the things that the university is planning is a diagnostic center, at Kameza, plus a pharmaceutical plant. We are working on them on the pharmaceutical plant, but the diagnostic center that the VC briefed me about, if this materializes, it will be huge for Malawi. As I said, some of the issues is identifying what is the problem with the patient or the client. We have clever individuals here. If they discover what it is, most of our surgeons, most of our physicians, etc., will be able to handle it. So we want, to go the route of artificial intelligence and see if it makes a difference. However, to harness the power of genomics, in Africa, where resources are often scarce, Malawi is the same. AI, artificial intelligence, has the potential to make a huge difference in terms of efficiency. So be able to detect issues as quickly as possible and to save not only money, but lives. My friend is an economist. He's always interested in saving money. I tell him life is the most important part of it. Another area where we can make a difference with innovations is genomic medicine. Again, this offers another frontier for improving healthcare outcomes in Africa by understanding the genetic basis of diseases. We will be able to provide the right treatment. Here in Malawi, ladies and gentlemen, the ministry embraces health technologies as vehicles for transforming the delivery of healthcare services to achieve the universal health coverage. As a result, the ministry now has a task force comprising key stakeholders. including the academia, which is promoting or advocating for health technology assessment. We consider this a step in the right direction, in line with a number of other African countries that have already embraced the concept. This regional dialogue is a perfect opportunity for us to strategize on institutionalizing and harmonization of health technology assessments in Africa for effective resource mobilization. If the minister was here, she was going to say diseases see no borders. That's why we need to work together as Africa. So the fact that there are 16 countries here also is a big advantage, because if we sort an issue out in Malawi, but it's not sorted out in Zambia, we are not safe until everybody is safe. So as a Minister of Health, we are very happy and grateful of this dialogue that we are having today. The future of healthcare in Africa is bright, but it's a future that we must actively shape. Yeah, so we really need to invest time. We really need to invest our minds to shape our own future. I think we should be self-sustaining. COVID taught us a lot. You can be rich with a lot of money, but this world can just shut down. And that's why we need to build local capacities. And you innovators, probably our immediate answer to this. And it's not only in health, it is in so many other areas. However, we need to keep adapting to change, and this transformation will not happen by chance. It requires vision, leadership, and commitment to collaboration at all levels. I'm happy that the academia is with us, and they are heavily involved. As I said, we have very clever young men and women in Malawi. Yeah. They just need some support from everybody, and things can make a difference. As we move forward, let us seize the opportunity to build health systems that are not only resilient and effective, but also equitable and inclusive. As we continue our dialogue, please let us remember the saying by Charles Darwin, and I quote, "It is not the strongest of the species that survive, the most intelligent, but the ones most responsive to change." End of quote. Again, had the minister been here, she was going to advise and warn Dr. Zulu that please don't keep these people till late, 7 p.m. Allow them some time to have a drive to Salima and see beautiful Malawi. So I've put those words in her mouth, but the message is to you, Dr. Elia Zulu. Let our visitors have a chance to move around Lilongwe, etc. It's a very safe country, very beautiful country. Otherwise, we'll come to the warm heart of Africa and wishing us a very good dialogue. Thank you.
Thank you so much, Secretary of Health, Dr. Mdolo. Thank you so much for those remarks, and really great that you even shared some of the innovations that the Malawi Ministry of Health is driving. So thank you so much. They say that after the government speaks, you don't say much. So I will not say anything else to add on that. I think he's driven very key points forward, and of course, challenging us really to ensure that we focus these conversations that can move us forward, but also just drawing lessons on what's going on from in this country, and having an opportunity to see Malawi beyond Lilongwe. Hopefully that will happen. I would like to call upon Dr. Leah Zulu. So this keynote leads us right into a very brief panel conversation that will then lead us into a tea break. This panel conversation is, we're calling it High-Level Dialogue on the Political and Policy Environment for Harnessing Emerging Technologies in Health. And so it's really following up on the conversations and the key things that have been said by the leaders who have just spoken in the last 1 hour. So Dr. Zulu, welcome. Thank you.
Guidelines the secretary to have. So I think in Malawi we say that when you do something wrong, you apologize by giving a white chicken. It can't be black or red or anything. So when I say I'll bring the white chicken. Height disadvantage again. Yeah? All right. So I think I'd like to invite the chair of AFIDEP to come to the front. Mr. Lamenyani and Mr. Singati for a brief chat. Spooker. And Professor Malewa. Oh, sorry. I think we are in a bit of a mess here. I think Dr. Ronje meant to really say, Professor Malewa, very, very welcome. When we're acknowledging people here, I kind of saw like, I saw you there, but looks like you are growing young, and I was like, it can't be that young. So I was just looking at you, Professor Bengo, I didn't realize you are here, but really, as the head of KUHES, the Kadekamu's University of Health Sciences, just to say welcome as well. And so I think the point is that the Secretary to Health has to go and support the minister in the work that the minister is doing. So what we'll do is that we'll just continue with the conversation here. And I think when the question comes up or in the discussion, people who know what the situation, how Malawi is dealing with this, can respond from the audience. If we happen that Dr. Gerard Matharu, who is the head of policy and planning, joins us, he will join us on the table. But I think we'll get started. And the Secretary for Health, thank you very much, sir. So this conversation is supposed to build on the statements that have already been made, but also allow the audience, if you want to ask questions on some of the issues that were raised there from the leaders, the continental leaders on emerging technologies, AFIDEP as the development agency for the African Union. So I think the introduction, why we are here, the importance of this topic has been really emphasized quite a lot. And I just wanted to really follow up on the issues that we are looking at. First of all, we start with the African Union. You started off, Mr. Lamenyani, about the changes at the African Union, the importance of really highlighting the issue of emerging technologies when the new leadership comes. We also know that the African Union now is developing the new STISA, the framework for science and technology. So can you just maybe shed more light on how you are seeing the technologies moving forward from the African Union perspective, and what you see as the big gaps that I mean, if you have to give a message here to the scientists, where from the African Union perspective, where the next efforts need to focus on, even as we get into these discussions over the next 2 days.
Thanks very much, Dr. Zulu. Ladies and gentlemen, greetings once more. I think, Dr. Zulu, as you mentioned, there is currently work progress in the ongoing revision of the Science, Technology, Innovation Strategy for Africa, which is popularly known as STISA, which has been in place since 2014. And now in 2024, the 10-year strategy ends. So the current situation is that the next 10 years, 2025 to 2034, is ongoing, to review it and to identify. Okay, let me go back a little bit. So what happened was that because the 10-year strategy 2024 is ending now in December 2024, so the 2024 strategy was reviewed, and the review identified gaps of certain things that were missing or that lagged in terms of the 2024 strategy. So now there has been a new drafting committee that has been set up. It's currently ongoing, and the draft is under review. And I think there's a great opportunity for everyone here, all the innovators and scientists and policymakers in this room, to be able to give input into this strategy so that it becomes as representative, as widely representative as possible. So there are a number of stakeholders who have been brought into the process of in the drafting committee. There are policymakers, there are non-governmental organizations, there are financial institutions, and I know there are some of you here who are part of that. And I'd like to say there's actually an opening right now, as we speak, for you to give input into how the strategy, how you feel like the strategy can better serve the needs of the community, as far as innovation, science, technology are concerned. And so that's one really big thing that's going on at the moment. So it's a public document. It will be shared, or it can be shared if your entity is interested in giving input. Please come and talk to us, and we will avail the document, and then you can go through it. And obviously, the process of giving input will then ultimately end up will be explained to you, and it will end up with the drafting committee, who will see what they put in terms of aligning the input with what has been drafted already. So that's one thing. And then the second thing is the continental artificial intelligence strategy, which was adopted recently and will be presented at the summit in February 2025 for the heads of state to endorse it. So, and the potential for artificial intelligence. So I think that as we discuss this, let's see how, looking at what the AU has put together in terms of the strategy, how do we cascade it into member states, and how do we nationalize that? Because AI has cross-cutting implications that has impact on especially health. We can actually take advantage of the artificial intelligence. So I really think that that's the next big thing. And the AU is leading because there is now a continental strategy that has been put in place that will be shared with all member states for domestication. And, and I believe that would actually help quite a lot. So for me, AI will be the next big thing.
All right. Very much. I think I would like to invite Professor Mfutso Bengo, who is a member of the Health Technology Assessment Task Force that the government of Malawi has set up to to come and join the panel. I apologize. I think as I was engaging with the Secretary to Health, there was some confusion. But the ministry said their main participation in this will be through the participation of the task force, of which Professor Mfutso Bengo from the Kamuzu University of Health Sciences, is a member and one of the leaders of the task force. Welcome, Prof. So, I'll just throw you right into the deep end as you settle here. So, in terms of Malawi, Malawi is hosting this meeting. How do you see the potential of these emerging technologies for Malawi? But more critically, what actions is Malawi taking to provide the policy framework and even the resources needed to enable adoption of technologies for health in general, but maybe with a focus on these emerging technologies?
Thank you very much thank you very much for the question. Sitting here, wearing towards one hat is academia, comes University of Health Sciences, and on the other hand, I've been asked by the minister and the PS to represent, because we're working in this task force. Malawi, we did a study looking at HTA in Malawi, the feasibility and acceptability. And we found that, first of all, the framework of accessing and adoption of health technologies in Malawi was inadequate. And as we are talking now, we saw that also at AU level, African CDC is championing health technology assessment frameworks, including WHO. So when we saw the gap, we did the research and we found that there was a need, and also we found that there was acceptability by policymakers to have it. Government quickly adopted it, adopted the evidence, and by establishing a task force of institutionalizing HTA in Malawi. And at the moment, what we're doing is the task force has got two work streams. The first one is looking at the governance structure of HTA, health technology assessment. The second one will look at value sets, because wrong values can lead to wrong decision. And the third one is financing mechanism and the capacity building. So actually, this coming Monday, we had already several meetings. This coming Monday, we'll be reporting to the senior management at the Ministry of Health to see what is on the status of the process. We discovered again that those who have got the highest burden of diseases do not have priority setting and efficiency mechanism of allocating resources. We discover also a kind of a contradiction. Those who have got more resources are having this framework. And those who do not have resources do not have a framework of how to use of efficient adoption and assessment of technology. And we found that also countries who are vulnerable to fake medicine in assessing which is more appropriate are not doing that. So it's a kind of a contradiction. Those who need more are not doing it. And those who have more are doing it. Thank you.
All right. Thanks a lot, Professor there. So I think this is a very good example of where now, I think we've talked about how a lot of these emerging technologies are not really part of the regulatory framework. So Malawi has now set up this task force to really look at how do you evaluate these or assess these technologies and then work with the ministry to to really make sure that they are part of the health system framework itself. So thanks a lot. I think as we go, we hope that we'll get lessons on how other countries are also looking at these issues. But I'll go to the chair of APET, which is the high-level, the African Union high-level panel for emerging technologies. We know as countries are looking at these emerging technologies, adopting, piloting them. How does APET, it's been, you said that it was formed in 2016. This is almost 8 years now. What do you see as maybe the biggest, the big achievement of APET, and how do you see its role evolving beyond identifying the technologies? Like when you start looking at the action part, what's the role of APET in this area?
Thank you so much, Dr. Zulu. Thank you for this important question. I would like to start with how APET has been created. And this is something which is amazing. Because the EUC chairperson in 2016 have Dr. Zuma. She has imagined that Africa, to develop its economy, to develop inclusion, to develop infrastructures, needs emerging technologies to leapfrog. So she set up a group and we start the work. And this high leadership is something which is extremely important. This vision for the future of Africa, this is extremely important. I want to highlight it. And this vision has been integrated at the level of countries. And we organize ourselves to reach each country through a network, the Scales Juma Executive Dialogue. Here, each country recognizes the importance to create a conducive environment so that the benefit of these emerging technologies can reach any citizen in all the countries. And this conducive environment is all about policies, infrastructures, partnership with international organizations. And this conducive environment is being put in place in Africa. Before I come to your question on the most important, I can say, achievement for APET, when I'm talking about the government, I can say that many governments have already designed their infrastructure for data collection and data storage. In Senegal, we have many data centers, and recently the government of Tanzania have set up a big infrastructure for data learning, for data using and data storing for AI in Tanzania. And this great infrastructure will be inaugurated in next month. So the leadership is important for these emerging technologies. If you have leaders that are convinced about the importance of this emerging technology, so we have the way which is paved to go through and develop activities that can leverage our economies through emerging technologies. To answer to your question, I think that if my colleagues agree with me, but I think that the AI strategy is the one document, one element which is the most important that we have produced. This document have been produced by African experts exclusively. So here in Africa, we have the potential, intellectual potential, to develop ourselves. And all the documents we have also produced have been elaborated by you. Some of them are here in the audience. And I'm proud to see that these frontiers technologies, where Africans usually need to go abroad and to learn. Here we have already this potential. So we need to capitalize all this effort and bring them forward so that we can have, what I say, a bright future for Africa. And this is one element. We have many reports on gene drive for combating malaria. We have reports on blockchain to sustain transactions and secure all these transactions. We have also a report on IoT, a report on energy, because all what we are doing, if there is not a system to bring energy which is available, and mainly in rural areas, because all these technologies should be accessible. And if energy is lacked, so we cannot go further. So it's important to bring, as the minister yesterday says, it's not only one technology, one standalone technology, but no, it's a bundle. It's many technologies which bundled, which gathered, can help to accelerate the development in urban areas as well in rural areas. Because, as I say, no one should be left behind. And emerging technologies are here to integrate all the categories of people, women, youth, disabled, all these categories of people in social inclusion, which is something which can be socially and develop an equitability in the social and economic system. So thank you so much.
All right, thank you very much, Professor. Now I'll go to the Chief of Staff at AFIDEP. AFIDEP is the Secretariat for APET, but the development agency for the basically the African Union. So I just wanted to understand from you, what do you see as maybe the key challenges, if any, or opportunities that AFIDEP sees in providing African Union member states the support they need to in their efforts to develop, pilot, and implement these emerging technologies from the AFIDEP perspective.
Thanks very much. So last night I was talking to my wife after dinner, and I was talking about the panel discussion, and we had a set of preset answers between the two of us. So she says, what if they don't ask these questions? I said, I will answer them anyway. So those will be my set answers. So I'm glad that you've asked a question that fits into the framework that we developed. So when I speak to her tonight, I will say, no, the answer was relevant regardless. So the point is, when we did the first 10-year implementation plan of Agenda 2063, the biggest limitation of it is that we simply had a dream for the 10 years. We didn't cost it. So nobody really knew what we were talking about in terms of the costing framework for Agenda 24, this first 10-year implementation plan. So I'm taking it somewhere. So when we did the second iteration for the next 10 years, one of the things that we were instructed to do was to focus on the costing framework. What is it going to cost Africa to implement this thing? So we worked with Paddy University to do foresighting and scenario planning exercise. And we landed up on two pathways. The first pathway looked at the as-is model. And the second one projected that if we are going to meet the second 10-year implementation plan, what would it require additionally for us to invest? So there are two numbers that are coming on stream. The first number is 5.6 trillion in the as-is pathway, as we are currently proceeding. And if we currently proceed that way, we are not going to meet these things. The second one is 9 trillion, and that is if we invest in a way that is going to allow us to meet the second 10 implementation plan. So there's a gap of 4 trillion that we have to look around and start asking ourselves, where are we going to get this $4 trillion over the next 10 years in order to move to the anticipated trajectory? And the reason why I'm raising that is because that macro scenario is as present in each of the sectoral analysis that we do. So if you speak about the health sector, the development aspirations that we have or the outcomes that we've projected for ourselves, at the current level of investment that we are making, we are simply not going to meet them. Maybe our analysis has not gone down to the extent of interrogating what does each sector need in reality. But the first question the first element of the answer is the financing question that confronts Africa. And it links to a statement that you said a little bit earlier on, the extent to which we engage with the global community in how financing of African priorities is undertaken, and that the money flows in to address global priorities and not what we define within the context of what we want to achieve. It's something that we need to shift. So health financing becomes an absolute priority, and the extent to which we are able to build an ability to engage our private sectors as a critical investor in the health financing agenda is going to be crucial as well. But I say that with tongue-in-cheek because we also have an embedded limitation in the private sector, which is underdevelopment of our private sectors, particularly in the healthcare sector. That's why you find that you have this situation where we are sending people to other continents for healthcare. So because our private sectors are underdeveloped. So if we are going to push for private sector development in healthcare sector, we are confronted by another burden of how do we invest to develop the private healthcare sector in the continent. So it's multiple challenges. So I've highlighted one. But overall, from our perspective as Auda NEPAD, our sense is that what we need to do is what the chair of APET said, is really to look at the ecosystem in its totality and ask ourselves, how do we enable the development of the ecosystem? And I'm not going to dwell into each one of them, but there are about 6 or 7 things that we have identified which are absolutely crucial. One has been mentioned, is healthcare infrastructure in the continent. 2 is the human capital element. I mentioned it in my opening remarks. We have to invest in the right human capital priorities to have to keep our people that we already have in the healthcare sector and to develop new talent around the healthcare sector. That is number 2. Number 3, linked to that is an inclusive agenda that integrates women and youth into our healthcare strategies in the continent. Number 4 is the policy and legislative environment. We have to invest in that. 5 is the question of science diplomacy with a particular focus on how do we engage in South-South cooperation and collaboration such that our the work that we do with the rest of the world in science, technology, and innovation has got contextual relevance to the African situation and to the developing context. The sixth and the seventh is what I've already mentioned, which is the financing landscape, particularly the issue of private sector and how do we integrate them into how we conceptualize our pathways going forward. So those we think are some of the main priorities, and what we could do is then to start unpacking around each of those, but I don't think that we've got the time to do that.
Thanks very much. I think so. That was the first sort of a range of questions, but I would like to open the floor. I think the emphasis we are hearing here from Professor Mfutso Bengo, governments need to start putting in this framework on how to systematically look at these technologies, see which ones make sense, and start looking at how we can, integrate them into the local healthcare systems in the light of what the framework that Africa CDC is thinking about. Out of NEPAD, there's a whole range of things. There's the policy part, there's the technology itself, there's financing. But I think the key aspect that came out of those 7 is also the issue about how do we bring the private sector to be at the center of this, because a lot of these technologies, for them really to be the actual development, but also the sort of the scaling up of the interventions. In many of them will require involvement of the private sector, and we've heard from the chair of APET on the technologies that have been identified. And I think artificial intelligence, which she identified, the guidelines, the report that they did, as one that is most critical, and also from the African Union Commission, the issue about political will to take these technologies forward. So if anybody, I think let me open this to the audience here. If you want to ask a question to any, I think it looks like we have 1, 2, 3, 4, 5. I should also mention, I see at the back there, is that Professor Kaunda. Yeah, also acknowledging the presence in the house of Professor Kaunda, the Vice Chancellor of the Lilongwe University of Agriculture. I see 3 Vice Chancellors have their hands up, and a lot of scientists here. So I'll give the lady Vice Chancellor from MUST to be the first one, then we'll go to Professor Malewa, Professor Kaunda in the corner there. There's a hand here, right? Okay. And the lady, so I see 6 hands. I hope that it will be quick. Professor Malata.
Yeah, thank you very much, moderator and the panelists. So the issues I will raise, basically I want to hear from the panelists their thoughts. I lead the University of Science and Technology. When COVID-19, hit all of us, each institution had to be innovative. And I think we saw Africa showing up and showing off what we are able to do as a continent. My concern has always been what we do, we only stop at the original level. No prototyping, no mass production. So I want to hear what can be done to enhance mass production. And then, but as we do that, we also need to look at quality and standards. Because many times people say we have this innovation, this is an emerging technology, but how do you grow that? Leading a university, what I learned over the past few years is that universities will come up, even inform governments, and since Prof. Mfutso is here representing government, we even go to the table. We share what our students and staff have been able to come up with. There's no uptake. How can we enhance governments to look at what's been developed locally? And then, uptake within countries. And then we can share best practices amongst countries. And finally, the issue of intellectual property. We've lost so much as Africa. How do we protect what our young people, our universities, our even community innovators, they don't have to go to school. There are many people that never went to school but have innovations that can make differences in the health sector, agriculture, and other sectors. So for me, those 3 issues, and I want to hear, perspectives of the panelists. Thank you very much, moderator.
Okay, thank you. Thank you for the wonderful presentations from the panelists. I'm Mark Malewa from Kamuzu University of Health Sciences, so my comments will be based on that. To me, one of the things that we need to focus on is who will drive this agenda. Who are the likely people to drive this agenda? And in my opinion, it's the young ones, the Generation Z. They're the ones that know simple things, to take in technologies. And just out of interest, I'm not sure how many students from the academia are here. I'm asking this because if you put together my students from CUHES, together with, for example, students from MUBAS and MAST, my students will ask, what, for example, simple, low technology can we come up with as a syringe pump? I'm giving that as an example. A syringe pump is something that counts the amount of fluid that you give to a child, an adult, per minute. It costs millions of kwaches. But there are simple technologies that can actually be used. It's students of that nature that can ask questions, and then their counterparts, together they can come up with answers. How do we engage the students? 2, it needs to be technology that is simple. I had a professor who used to say, Mark, do simple things first, but do them well, before you can go on to complicated things. Because it's the simple things that are easy to sustain and scale up to higher levels. I'll give an example. At CUHES and MUBAS, with the support of the students from Rice University, we came up with a breathing machine, Pumani. It's a machine which in full capacity in the West would cost thousands of dollars. But this is a low-tech that uses water to help small babies breathe. That machine is now used all over the world. I went to India one day, somebody was bragging that they got a fantastic machine called Pumani, and in an African language means breathe, and they're telling me. This is a machine that was developed by our students, young students, but issues what that Professor Malata has talked about, intellectual property, we lost out. That machine is selling like hotcakes everywhere in the whole world, but we never benefited from that at home. So simple, sustainable, and easy to upscale. But we must also not forget about social innovations for health. There are simple things that can transform lives. The SH was talking about the Chipatalajapa phone. It's part of its mobile phone clinic, what, if you may call it so. It's an example of social innovation for health. There are lots of other examples. Again, CUHES has got a center of innovation, social innovation for health. Simple things. If you bring people together, they can come up with simple ideas. But also issues of applications. Professor Fuso Bengle hasn't talked about his application, an app. Again, in this day and age of Generation Z, if you challenge young students, they can come up with applications. I am working with small young guys to come up with an application that can actually detect early signs of stroke so that they can be identified and help them before it gets out of hand. Simple things, but my opinion, my point is, it's the young ones. We need a platform where young students from CUHES, MAST, Luana, MUBAS, UNIMA, you can bring them together, come up with ideas, and together they can come up with solutions. They have to be simple for them to be scaled up and sustainable. But also we need to build in issues of trading and intellectual property.
All right, thank you very much. I think the in front here, very well noted there. Who drive the agenda? I think he asked the question, where are the students in the room? I think I'll not ask the question. It doesn't, I mean, there are a lot of students. It means, it depends. I think when you talk about Gen Z, that's different from students, but I think we need more Gen Z. But I think it's likely I can see a few Gen Zs. Who identify as Gen Zs in the room? Can you raise your hand? Okay, there are a few, Professor Malewa, not as many as I think you would have wanted to see, especially from the universities. But yeah, the point is well taken. The youth, the young people need to be on the table. Yes, madam.
Okay. Thank you very much, moderator and panelists. My question is for Dr. Lemanyane. We are happy and excited about the continental AI strategy, but I would like to know the next steps after this strategy is launched, because this might help us start preparing on how we can contribute to its successful implementation as different groups of stakeholders. Thank you.
Oh, I thought I was not counted. Yes, I have a very simple question and would like to hear the view of any of the panel members. And my question is really, when we consider Agenda 2063, the Africa we want, what is critical to monitor the development leading into the target is, to what extent are these emerging technologies facilitating and empowering intra-African collaboration?
Yeah, thank you very much. My question goes to Dr. Lemanyane again. We are glad that now we have an AI strategy for the continent, which is good. But learning from the Malabo Convention, which was approved in 2014, African countries took almost 10 years, actually more than 10 years, to adopt the convention in 2024. By the time they were adopting it or ratifying it, almost half of it was outdated. What are the plans for AU to advocate for speedy uptake of the AU strategy by African countries?
Thank you very much. I think there's one in the corner there, and then we'll go to Professor Kaunda. Yes.
Thank you, moderator. I have simple questions. The first one is about CESA. The previous intervention talk about the revise of the strategy. I want to know if you try to see the lack of the implementation across Africa, and if you put the monitoring system in terms of the implementation. The second one is I'm concerned about if all countries in Africa now know the emerging technology. And the last one, I also noted that the lack of synergy among multiple initiatives across Africa, like CBD body or climate change. And I don't know if inside the room people know now the global framework biodiversity, the Montreal coming global framework on biodiversity. Thank you.
My name is Juliana. I want to appreciate the panelists, and I also want to stand with Professor Malewa for his comment. I've always wondered, when we talk about emerging technology in Africa, I ask the questions, whose technology are we talking about? Are we emerging? Is it African technology? Or are we borrowing technology from somewhere? Because like Professor Malewa said, when you go around primary schools, what we call in Nigeria primary schools, secondary schools, up to tertiary institutions, you will be amazed at what these young people are doing in technology. They are innovating. They are anxious. Who will develop them? Even the government themselves are not encouraging these young people to build on thinking on. And we are now talking of adapting emerging technology. From where? Thank you.
Thank you very much. I just wanted also to follow up on the science, technology, and innovation strategy for Africa 2024. Having interfaced with AU AFIDEP for some time, when the STIZA, which just expiring now, was being formulated, there was quite a bit of consultations. But what I also saw was that most of the higher education institutions, they were now trying hard to align with the STIZA, which always there's a little bit of disjoint between the implementation, the formulation, particularly inclusiveness of higher education institutions. I thought this is an opportunity now, as we are readdressing and coming up with a new STIZA, that we should have perhaps a coordinated way where higher education institutions can input into the formulation process. I don't know where we have thought of a way. A few associations have been trying very hard to align with the STIZA. Can we have that opportunity? Thank you.
All right. Thank you very much. I think we've pretty much taken all the questions. Looks like there's one more there. Let's take that as the last one, and then we see how we move forward. I think we may not have time to exhaust all the questions. There are key themes that have come up that we'll address, but we are all here the next few days. Let's hear the last contribution there. Yes.
All right. Okay. Thank you. My name is Innocent Chibwe. I was looking at the title of the meeting here, leveraging emerging technologies for improved healthcare. Now, learning from the post-COVID era, we've seen much of the improvement in terms of technology in most of the healthcare systems, but there is still a big question mark. Despite those heavy investment, we haven't seen much of the sustainability means from the government to be able to adapt to these technologies. So I just wanted to understand from the government side, or maybe learning from other countries, because we are 16 countries here. Maybe we can learn from others as well. What are sustainability means which the government has put in place to make sure that as we are adapting these technologies, we should be able to sustain them, and then so that maybe we could continuously use them effectively. So I just wanted to understand that from the government side. Thank you.
All right. Thank you very much. So, panelists, a very, very big range of questions here. There are questions regarding STIZA, how do institutions of higher learning, maybe explaining there what's the there's already a team that is working on this. Who is in that team? What are the opportunities for people to input? Are the opportunities there? I think there are questions that we learned about how do we make sure that young people are at the center of driving this agenda. There are questions that have been asked regarding, especially from the African Union, how long it takes from innovations being tabled to adoption by governments, giving the example of the Malawi 2014 example. How are we going to make sure that this issue is not we are not going to face the same issue? So I think you were taking notes. I just want to see, maybe let's talk first about the STIZA, which is the sort of underlying structure. I think the important thing to note is that APET is really responsible for all technologies in agriculture, in forestry, but this meeting is really focused on looking how we actually look at the role of those technologies for the health sector. but the agenda is quite broad. Mr. Lemenyane, maybe if you can get us started there on these issues about the processes at the African Union, but punching in more on how STISA the 2024 one maybe can be done differently, or how people can input.
Okay, thank you very much for the question around STISA. So, as I mentioned, there is two formations that have been put in place. I spoke earlier about the drafting team. So the drafting team works very closely with the task force. So the task force composition has the following membership. The member states, regional economic communities, academia and research institutions, there is the private sector, civil society and partners, international organizations, including women and youth representatives, as well as African Union system relevant bodies, AUC departments. So this structure, this strategy is coordinated from the Department of Science, Technology and Innovation at AUC, with the Commissioner of Science, Technology and Innovation at the head of the process. And so at the moment, I don't have the name of the person who represents the private sector, but I can assure you that please let's have a conversation after lunch. I will have the name of the person who represents academic institutions on the task force, so that you can give your input through that person. So please talk to me after lunch, and I will have that definite name and person and contacts for you. Does that help? Okay.
The opportunity is there, in other words, for various stakeholders to input.
Absolutely. The time is now, because after this, then the process is going to move. There will be a meeting in Egypt that will consolidate, and in December, the committee has to submit. So the time is actually now. So let me get you that information and then relay it to you, and then we can get in touch with the person and see how we coordinate your input into the strategy. Thank you.
Okay, artificial intelligence, you want to respond to this question? I mean, some of these big innovations, how long it's taking to move to adoption, and how that is how you are looking at addressing that.
Right.
How the NEPAD can also be jumping in on this,
Yeah, I was going to say my brother can also come in there. So in terms of, there were two questions. One was the next steps, and the fact that countries take time. Some countries take time to adopt, or to uptake these strategies that would have been formulated at AU level. So the next steps, I think I would give to Dr. Spuka to respond to that. But in terms of where things stand with AI, so there is acknowledgement that African countries are very, very different in terms of population, in terms of economies, in terms of just how country developments, in terms of per capita income and all of that. So certain countries are already on their way. So I'll give you an example of countries that have initiated, even before the AU started this, that have their own strategies, either in development, or some have completed the AI strategies. I'm aware that Nigeria is working on that. I'm aware Kenya is. I'm aware South Africa. I'm aware of Egypt. So those are just some of the countries that I'm aware of, in terms of them leading already with the strategies. So what we do at the AUC is to ensure that, with the understanding that countries are different, we put the strategies in place, and then we share them with member states to domesticate them depending on their needs and their community, their economies. Obviously, all of these things have cost implications. So the country would domesticate it, looking at what they can do with the immediate, what they can do in the medium term and long term, and looking at how much they're willing to invest. And also issues of infrastructure, internet connectivity, and all those things. So some countries are already way ahead. some will come, but I must say that it's very critical that all African countries come on board, and the AUC will do all its best to ensure that we promote uptake of AI, because we understand the impact that it can have on the economy, across board, on health, on agriculture, on business, on innovation, and all of that. And so that's where things stand. So certain countries are ahead, others will come, so they will take what the AUC has developed already and beef it up according to what their needs are. And so AUC really lays out a template, and countries domesticate it, according to their own needs and priorities, economic priorities as a country. So I think Dr. Spuga can speak to that.
You want to add on maybe any of the other questions that came up where you think there's the issue, you also emphasized the issue about putting youth at the center, and I know the head of AFIDEP has even a special program on youth. There's a question that was raised, who drive this? It's young people who are really doing this, but a lot of these innovations young people are coming up with, to identify them, to really see that they can play a big role and start thinking about how to bring them into the systems, bringing them to scale is a big challenge. How do we even support young people in developing these ideas further? I think you can speak on that, but also I would like Professor Mfutso Bengo, being, from the university setting, how do you see this moving forward? How is COHES as well looking at putting youth at the center of these processes? But starting with you from AFIDEP.
No, thanks very much. I think the more formal process, my brother has already touched on it. But as we think about the more formal process, there are other questions that are emerging which have come up in our discussions over the past 2 days as well, internally. This inverted relationship that is starting to emerge, where policy is lagging behind practice. And that's the reality. Because effectively what we're saying through the inputs that are coming in and the narrative and what we're seeing with our own eyes, is that we are still speaking about an AI strategy for the continent and taking it through AU processes of STC and then adoption by member states, etc. Private sector has made huge investments on AI across the continent already. The youth have already started using this thing for over the past 3 years exponentially to drive their businesses. Within our own organization, as AFIDEP, we've started to think with our tech people about how do we build our own AI system that is able to bring all of the data that exists within our own organization such that we're able to tap to it in it with ease. So at a practical level, we're seeing this inverted relationship between state and citizenry in relation to how the policy and practice relationship, we've always understood it. And we're lagging behind. And it's something that we have to consider what are its implications. And it's starting to ask a fundamental question of disruption in relation to policy and how the technological revolution that is happening is effectively disrupting the whole system of policy development as we've always known it to exist. So we may be stuck as AUC and all of these formal policy organs, etc., starting to think about, stuck in how we've always used to do things, but the reality is different. It's a question of how do we respond to that. And I think that question links very well to who will drive the agenda. This synopsis that I've just given is who will drive the agenda. And the reality is the answer is not a conceptual answer. It's an answer that finds expression in practice. People are already driving. It's the people of Africa who are already driving the direction around which, for example, AI and all of these technologies are unfolding within the continent. The youth are at the center of that. Private sector is at the center of that. Social innovators are at the center of that. But in that framework, I don't think that we should necessarily stop them or hold them back from doing that. That's the disruption that we need. However, what we do appreciate is that there are social considerations and there are things that do need to be regulated to the benefit of society in how these things are evolving. So I think the primary prism through which we should be looking at, particularly our policy and legislative frameworks, are the ethical questions that surround the usage of these technologies, their impact on social security, on privacy and data-related issues, etc., etc., etc. And those then become the main focuses of area around policy and legislation. But the other elements, we must accept that they are moving on their own organically. And that means that, as I said, the disruption is happening. So the other element that I think is quite crucial, and I know that we're running out of time.
So I have, Dr. Ronje has already given me a yellow card, so I don't want to get raised. So if you can sum up quickly, I want to give Professor Bengo and also the chair there one question, but just wrap up. I think your thought on that.
My wrap up is around the coordination on STISA. To be honest with you, the fact that a leading university representative is asking us about STISA coordination and participation, when today there's an all-Africa consultation meeting that is happening with all of these stakeholders, it must be an indication that our coordination is not strong enough at a sectoral level. The reality is that you will not be able to bring all universities or all university representatives or academia into the actual consultation process. But what we could have done better perhaps is then focus on sector-wide coordination mechanisms that brings universities across the continent into a consultation process where representatives would then sit in the meeting that is sitting today. So for me, that question begs of us to strengthen the coordination efforts that we are making, and that maybe that's a conversation that between ourselves and the AUC we should be looking into, but there's room for improvement from our own end. So it's self-criticism, and that is feedback that we should take.
All right, Prof, how do we drive this moving forward? And please make it use the shorter version.
Yeah, so I'm talking this at the personal level, not representing government. I think I just wanted to flag it out that we need to be careful inequities, 1090 gap, not between the north and south, but within the same country, between genders, unequitable technological access between gender. It can happen that the whole technology, only 10% of the population is accessing and 90% is left behind. It can be demographic, young and youth and old. I can say that the ones who can are the youth, but the ones who have got access are the old, who don't have even a capacity. So we need to be careful. If we don't breach this 1090 gap, in technological access and utilization, it will still remain behind. I just wanted to say that the demand and supply of technology needs, first of all, champions. You need leaders. You need the ethical consideration. You need policy governance. You need system. Sometimes you can have the policy, but without the system which can actually lead you. Why am I saying that? If we don't fund, if we don't finance, even if you have got good ideas, the ideas will not go far. If you don't have governance system, intellectual property, at the moment, for example, I talk in Malawi, intellectual property, it's a very expensive to register for a patent. It's not, a poor person cannot. So we were talking about this, but it's so difficult to register something. So what more people were in the villages? So I just want to say the governance structure is very, very important, but also we need to say, okay, we may have the governance structure, but we're financing the intellectual property. I just wanted to say also that who is driving? We have seen it has nothing to do with resources. We have seen some poor countries, because they have champions, they have managed to go ahead. Rwanda, for example, they put technology as a priority. So where are the resources going? If you look at even our African Union, okay, we can talk about Abuja Declaration where 15% of the budget. What about science and technology? What is the portion of the budget? We're still talking about 1%. Can 1%, if technology, China is moving forward because of technology, can Africa with 1% or 2% move the agenda, manage the 10-90 gap? Those innovators who are in the villages, barefoot innovators, will they be able will we be able to finance their technology with 1%? So we can talk about that. We need leadership, we need ethical consideration, we need governance, but we need systems, and systems we need finance. Where are our priorities? Thank you.
Thanks a lot, Prof. I want the chair of the APIT, the High-Level African Union Panel on Science and Technology, to kind of wrap up for us. But I think the lingering question there, Professor, Madam Professor Juliana said, so what is emerging technology? Technology is changing. We know APIT has, gives guidelines on all these technologies as they come. But maybe as we go through this regulatory framework, because of the high level of innovation happening, there's another technology that is coming up. And I think Professor Malewa talked about some of these social innovations and so on. So what's one, I think we have the word emerging technology. There seems to be a call there to say, how do we define that? Why should we call them emerging? Maybe if you can respond to this on this issue, and then just give us your closing statement. I will not go to all the panelists because Dr. Oronje has already given me red. You can't get 2 red cards in one game, right? So I'll let the chair just wrap up on our behalf.
Thank you, moderator, for this privilege. I want to first of all say that here in Africa, there is a lack of communication. When the lady talk about what is emerging technologies, and she is using emerging technology, AI, maybe in her mobile phone, in a laptop. So emerging technologies are now everywhere. In all devices, you'll find one app which is based on emerging technology. So maybe APET need more communication. You have a network in all the countries in Africa, a network of scientists and science communicators, science advisor of ministers and so on. And they are here, some of them are here, and the role of this network is to share information all around Africa. Those emerging technologies we have identified have been brought, and we need uptake from the countries, all the countries in Africa. So we have established a system to disseminate those information. Coming on the role of youth, you are right. During COVID, we have seen astonishing creativity from the young people in Africa. and they help government to manage this pandemic in Africa. And that's why maybe there were not so much death in Africa, because there was a comprehensive approach from the government. And I think that here you're showing this creativity, showing this easy uptake of technology, showing also the ability to absorb this technology and translate it efficiently to create local solutions. We have to work with youth for any strategy to develop emerging technologies in Africa. And it's important to highlight the role of youth, because there are those who will implement. But it's as network as the chair of staff has.
This is how the discussions are going on here at the BICC, where the African Institute for Development Policy held this meeting to discuss quite a number of important issues into as far as using technology to enhance the health, to actually enhance issues that really affect the healthcare system. But also quite a number of issues have been discussed at this meeting, where different players who have come in from different countries, they've expressed their concern on how technology is used, and also on how technology can improve the healthcare system. This event is ongoing. We still have quite a number of hours, and these discussions will keep on going as we wrap up here at the BICC. Well, on behalf of our technical director, Mr. Dev Chapita, and also on the sound console, we had Louis Jonas. Our reporter from the newsroom was John Paul Kayuni. Our cameraman, we had Gift Dupimba and Hadson Bisan. And also on the internet, and making sure that those of you that were watching on Facebook are able to watch, we had Kuma Rogers, who made sure that those of you that were watching online had a chance to watch and also experience and learn more about how technology can improve the health sector. My name is Robert Kalua. Keep watching Zodiac Television.